Kelly, it's nice to see your face.
You too. It's been a long time.
It's actually just so nice to see everyone every now and then.
How's below your waist? How's your belly doing?
It's good. It's good.
Good.
I won't stand up, but
Yeah.
yeah. So it looks like we have people joining quick. I think a lot of people will probably join us for this talk.
Right as we're starting, yeah.
We have about 60 people right now, so let's just give people a few minutes.
Yeah, we'll give it. Yeah. So I took out that thing about telling people they'll be anonymous or whatever. So because I figure you're going to say it anyway.
Yeah.
And most of the people have done these already now. So.
Yeah.
I realize I shouldn't do my coffee. Then people will see. Nobody can see us yet, right? Just us.
All right. Well, let me at least start making some announcements.
Yeah, that's a good idea.
So it looks like we have about 70 people. I think probably the next few minutes, probably a lot.
Oh, they can see us. They can hear us.
Yes. So I'm Dr. Tano. Today we're going to have a talk from Dr. Tanenholz and Christina Schrack, who's one of our NPs. The two of them are on our COVID task force. So we have about 5 doctors and NPs and some administrative people who meet every week to get our protocols updated and everything to practice. So they're going to speak today. But later this week, we have another talk. I am completely blanking. I don't know how that just, sorry. Let me see what the webinar for this week is. I should know the answer to that, but, oh, it's me, haha. Oh my gosh. This is what happens on Mondays. So on Friday, Dr. Christina Council and I are going to give a talk on health disparities and race. Since that's in the news, we wanted to talk about that a little bit. And we're going to have a few more of sort of similar talks in the next couple weeks. The schedule is changing, so just make sure that you're looking at your emails as they come out with new talks. And then otherwise, since we might have a few new people today, just remember that these sessions are recorded. Questions that you submit to that QA tab will come to me and the other presenters, so those are private and people can't read them. But questions that you submit to the chat, depending on what privacy settings you select when you put in the your question, there's a people can see them depending on how you submit it. So just so you know, the QA is relatively private, the chat is relatively public. And then on our website, the RIMG website, we have posted all of our old webinars if there are things you want to look at. And that's where there's also the upcoming schedule of future webinars and all the links to them. So if you ever don't get an email and you're like, hey, I wanted to know what webinars are, then that's a good place to look. So you go to our website, and then you click on the COVID webinars, and from there you can find everything. And that's about it. So I think I'll let you guys have the floor. As I said, Dr. Tanenholz and Christina Schrack are going to talk about COVID, and we're going to address a lot of your questions about testing and antibody testing, because as a practice, we're getting a lot of those. And we already have questions coming in. So I'll let you guys get started, do your talk, and then anything that you don't directly answer, we'll be sure to try to get to if we have time for all the questions. So with
give me just 1 minute. I got to start my slides over. They advanced before I was ready. So give me 1 second. Okay, can everyone see that?
They see
no? Okay, give me 1 second. I think I'm not on the share slides anymore. Give me 1 second. So I'll go back to the beginning. Okay, give me 1 second. Okay, give me 1 second. Can everyone see that? I'm gonna go back.
I think it's still, yep, that looks good.
Okay, good. Okay, so for some reason, well, let me go backwards. it's going backwards. Let me a second. Give me 1 more minute. Let me just start back. For some reason, it's advancing, even though when I'm not telling it to advance. Let me go back to the beginning. Give me 1 minute.
So for those of you who are sending questions about technical suggestions to our email or advice line, just know that we are physicians and we are trying our best to
no, we've got it. It's just
to provide these webinars. So we're not the most tech savvy crew on the planet. So we're
give me a second. Okay, can everyone see that?
Not yet. I don't see.
Okay, give me 1 second. It wants to go.
Why don't I start answering some of the questions while we're waiting?
Oh,
yeah, you go ahead. I'll get this.
Okay, that's a wonderful idea. Okay, so question.
Dr. Tanenholz, are you on a work computer?
No, it's not that. It's just advancing. So I'm trying to get it back to the beginning of the slides. So give me 1 second.
Just find the time option and turn it off.
Say it again.
Find the option with the timed and then just turn it off or click the check mark. It's all it is on timed. So you just have to turn it off.
Oh, I see what you're saying. Okay. I never did the timed one. Okay. Use timings. No timings.
Yep, there you go.
No, okay, can everyone see that?
Go.
Yes, we can see it.
Okay, now we can get started. Sorry for the delay. So thanks for joining us today. Sorry for the delay. And I'm Dr. Kelly Tanenholz, and Christina Schrack will also be presenting with me today. So most of you have probably been on our other webinars, so we're going to review a few things just in case some people were not at the other talks. And then we're going to talk about a few new topics, which we haven't spoken about on the first two webinars. We'll talk a little bit more about testing, including antibody testing. And then we'll talk a little bit more about how we're getting back to sort of a new normal at RIMG, and then we'll take questions as usual. So just a little basics and background. So COVID-19, as you know, is an infectious disease caused by the severe acute respiratory syndrome, coronavirus 2, first identified in December of 2019 in Wuhan. And as we all know, it has spread globally, resulting in the ongoing 2019 to 20 coronavirus pandemic. So the CO stands for corona, VI for virus, and D for disease, which is where we get COVID. And then, of course, the 19 is because it was discovered in 2019. And there are many types of human coronaviruses, including some that cause your typical mild upper respiratory illnesses. And then, of course, is this the same as SARS, the one from 2002, 2003? It is not, but it is a cousin to it and in the same family of viruses. How is COVID-19 spread? So we're continuing to learn about this. We know a lot more now than we did a couple of months ago, but we do know that it spreads easily between people. And it definitely seems to spread more efficiently than influenza, not as efficiently as measles, which is also highly contagious. It's mainly spread through close contact, person to person, in respiratory droplets or other secretions such as saliva from someone who is infected. But do keep in mind that some people who have no symptoms are able to spread the virus. So how can you prevent the spread? So always remember to wear your masks. You want to try to stay 6 feet apart from people, about 2 arms length for most people. Remember to wash your hands frequently, which is always a good policy anyway, and avoid touching your mouth, nose, and eyes. And of course, if you're sick or not feeling well, definitely stay home or seek medical care. So the symptoms. COVID-19 usually has an incubation period about 1 to 14 days, most typically around 5 days or so. The most common symptoms, of course, are cough and shortness of breath. Some patients have fever, but not always. In fact, you can have many patients without fever and sometimes without cough. Many patients we're also finding have diarrhea or nausea, and other things like new loss of smell, sore throat, of course, shortness of breath or difficulty breathing. So as you can see on this slide, it mentions, this is from the CDC, some warning signs or things that would mean you need to seek emergency care. Obviously, trouble breathing, persistent pain or pressure in your chest, any kind of new confusion or mental confusion, inability to wake up or stay awake, or your lips or face becoming blue, which could be a sign that you're not getting enough oxygen. And so this is our sort of new and extending list of typical symptoms. At the beginning, the CDC only had about 5 or 6, then we added a few more, and now we have a longer list. Most of these we've mentioned. They've added sore throat, congestion or runny nose, nausea or vomiting, diarrhea. And there's a website here if you want to copy it down, or it will be on our slides, where you can find out more about symptoms. And there's a symptom checker to see if your symptoms could be consistent with COVID-19. Who is high risk? And I think most of us are aware of this now. People with compromised immune systems, people with diabetes, asthma, chronic lung disease, cancer, and other chronic illnesses, which could make them more prone to getting ill faster. So what can you do to stop the spread? So as you all know, Montgomery County is now in phase 1 of reopening. But I still advise, and I think most of us will, that you did try to avoid spending time in crowded public places. And obviously it's okay to go to the grocery store, to go to the pharmacy, spend time outdoors in the fresh air. If you're close to a lot of other people outside, it's definitely advised to wear a mask or other facial covering. And I believe it's still required in grocery stores and other stores to wear a mask. And now some restaurants are open for outside seating only. Which decreases the spread when you're outside in the fresh air. Still try to maintain social distance, about 6 feet. And do remember that it can be spread from contaminated surfaces or objects, but we do not think this is a primary route of transmission. So yes, you should clean things and be careful, but it's very unlikely that you're going to get coronavirus from touching mail or another surface. So this just summarizes a little bit about the reopenings in Montgomery County currently. So retail stores are opening for curbside, restaurants have pickup and now have outdoor dining. More childcare places are opening. Sports, certain low contact sports are allowed with limited practice for children and youth leagues. Hair salons have started to open with limited services and I believe limited number of customers in the stores at the same time. There's certain rules for camps, which really limits them. Most of the camps I'm aware of in Montgomery County are not opening for day camp, but there may be some. Car washes, exterior cleaning only, and then manufacturing is open for operations. And then this just kind of summarizes this and goes into a little bit more detail. If you look on the Maryland Department of Health website, you can find answers to more detailed questions about things and how they can open. And then this slide comes from the Montgomery County website. It's very useful. They have this COVID-19 dashboard, and I'm pretty sure they update it daily. These are the numbers as of yesterday. So if you look at this slide, you'll see that we're meeting a lot of these criteria where it says 14 out of 14 days, which is very good. The number of new cases, this 169 is a 3-day average. So the new cases are declining, and for the last 6 out of 14 days, it has declined. New COVID-related deaths has gone down every day for the last 14 days. The 3-day averages have gone down. That's very good. Hospitalizations are also declining. Emergency room visits, ICU hospitalizations, intensive care beds are down. Ventilator use is down, which is excellent. And then the positivity of tests, they said 12% was the 3-day average in Montgomery County as of yesterday. And then if we go back here over on the left, you'll see the acute care bed utilization rate. That's the only one that's sort of kind of lagging behind. It's only gone down for 2 out of 14 days. But as that gets closer to the 14 days, I think Montgomery County will look also probably to move to the next phase of reopening, which most of Maryland has already done. Montgomery County and PG County, maybe Charles, I'm not sure, are also still on phase 1, and DC is still on phase 1 too. And then the next slide, it compares all of the different counties. So a lot of people wonder, well, how come different counties are opening more than Montgomery County? But if you look here, you'll see that Montgomery County, the percent positive testing is at 10.8%. This is, I think, as of Saturday. And then Prince George's is at 11.78. So those are 2 high ones. Kent County also is high, although I'm wondering if their volume of testing is very low. This is just a percent positivity. But if you look around at some of the other counties, even Baltimore County is much lower than Montgomery. Talbot County is very low. So these are some of the numbers they look at in terms of figuring out how things can reopen. It's also important to note, though, that in Montgomery County, as well as Rockville Internal Medicine in general, we are doing way more testing now than we were before. Also, a lot of patients are getting tested just so that they can have surgery. So we're doing a lot of asymptomatic testing. So that's going to drive these numbers down a little bit in terms of percents. But when you compare it to the other counties, we are still a little bit higher. So, and then, so this is just a list that kind of summarizes activities and their sort of risk in terms of getting COVID-19. There's an article from NPR that you can look up to find a little more detail on this. But they list several things here that are low risk: going to the beach, obviously with social distancing in mind. Same thing if you're sitting at a pool, which are not quite open in Montgomery County yet. Letting a friend use your bathroom, just one person, low risk. Going to a vacation house with another family, again, low risk. Camping, low risk. Some other things are a little bit higher risk: hotels, barbecue in the backyard with one family, public restrooms. And then a higher risk are obviously eating indoors at a restaurant, which is not yet allowed in Montgomery County, but other parts of the state it is. Outdoor celebrations, such as a wedding with more than 10 guests, that would definitely be medium to high risk. Haircut, medium to high risk. And indoor religious services, presuming a large number of people, again, would be high risk. So I'm going to let Christina take over, and she's going to talk about what you should do if you think you have COVID, and to discuss some of the procedures in our office at this time.
Hi, everybody. So just a reminder, we went over this the last time as well, but just please just call us if you're not feeling well in any way at all. The symptoms can be confusing, constantly changing, and then we'll schedule a virtual visit with you and determine if testing is needed. And additionally, if you have been tested elsewhere and you are positive for COVID, please let us know so that way we can follow up with you and check in with you on a regular basis and make sure that you are doing okay. Again, most patients don't need to go to the ER or the hospital, which is good news. So that is why we have a protocol in place where we are calling our positive patients on a nearly daily basis to check in with you and make sure that you are feeling okay. And then also remember that we always have providers on call, nights, weekends, 24/7. If you do have COVID, this is a breathing exercise that was shared the last time that has been proven to be somewhat helpful to help expand your lungs and help with secretions, drainage. So just something to take note of. And again, this will be available on our website, so you'll be able to access the PDF to our slides. Okay, so a few updates here. We now have, well, we've had the PCR, which is the nasal swab. So, but now we also have the serum antibody blood test. So these are two forms of COVID testing that is now available at RIMG. So the first one, the PCR nasal swab, is to test if you are actively infected with the COVID-19 virus. So essentially, this would be a test for you if you think you have an active COVID-19 illness, or if you have had close contact with a COVID-19 patient. Call us to schedule a virtual visit, and we will order the testing if we feel it is appropriate for you. The serum antibody blood test. This test detects if you've had prior exposure to COVID-19 and have built an antibody for the virus. So essentially, the positive antibody means that you've been exposed to the virus and that you have some degree of immunity to future infection. However, we are still learning about the antibody results, and if it truly means that this definitely offers immunity for you. And even if you have a positive antibody test, the recommendation is to still practice universal precautions. So this would be a good test for you if you think you may have had COVID-19 in the past, you didn't have an active test, and you have been recovered for at least 2 weeks. Schedule a virtual visit with us. It does take at least 2 weeks to build up the antibodies in your system, so there is no sense in testing sooner for the antibodies. Okay, so this we're going over some of the testing and the sensitivity and specificity. So again, the PCR test, which is the nasal swab to test for active infection, looks for active viral material present in your body. So this test will still miss some patients. Some studies suggest that up to 15% of patients who test negative may actually have COVID-19. So depending on your situation, your symptoms, you may still have COVID-19, even if your testing is negative. And again, when you speak with your provider, they will guide you and tell you, your results and let you know what they think is going on with you. So if you are negative, we may still advise you to take the same precautions as we would with a positive test. Some more information on the COVID-19 antibody testing. So again, this means that a person has been infected in the past. It does not mean that they are currently infected. The antibodies start developing within 1 to 3 weeks, so that's why it's important that we test no sooner than 2 weeks from feeling better. And again, the recommendation is to still continue to take steps to protect yourself if you do have a positive antibody test. And people who receive positive results on an antibody test and who are currently or recently sick or have been around someone with COVID-19 should follow CDC recommendations on caring for themselves and protecting others, and when they can be around other people again. All right, so more about the antibody test. There's a lot of different antibody tests on the market right now, and I do see a lot of questions coming up about this. So some of them are more accurate than others. So we may have some false positive antibody results, meaning that the test result says that they have an antibody when indeed they do not. So this is why we have to be very careful when using antibody testing. And then the other thing to consider is that we aren't exactly sure what having antibodies to COVID-19 means. So essentially, we are not sure how much immunity these antibodies provide and how long any immunity will last. So we don't know, let's say you test positive for COVID-19 antibodies, we don't know if this will protect you for several months, several years, several weeks, and we don't know if it will definitively protect you against the virus in the future. There's also a link to a video about antibody testing, and it just kind of goes over why we can't always trust some antibody testing. So this is some information about how you can help. So as some of you know, we do partner with Meridian at Rockville Internal Medicine Group, which is a research group. And Meridian currently has 2 COVID-19 studies. The first one is if you've been infected with COVID-19 within the past 60 days, and this has to be confirmed via a nasal swab, then you may be eligible to participate in a research study with our on-site research group, Meridian. And essentially what the study will involve is blood donation for research regarding COVID-19 to develop new treatments, diagnostics, and preventative care. And then finally, also very exciting, Meridian is also in the running for COVID-19 vaccine trials. And we are looking for any adult volunteers who would like to join the clinical trials. If you are interested, call the numbers below. The vaccine trial has not yet started. We are just enrolling and gathering names of those who are interested. Another way that you can help if you have had confirmed COVID-19 or antibodies is to donate plasma, which I know some patients have done this already. So essentially, people who have fully recovered from COVID-19 have antibodies in their plasma that can attack the virus. And this treatment is being evaluated for patients who are critically ill in the hospital. And the links are here to look into plasma donation. All right, so it's been about 3 months since COVID emerged in Maryland. And this is kind of an update on what's going on with Rockville Internal Medicine Group right now. So we have been doing primarily telehealth visits since mid-March, as most of you know. We are still open to see patients in the office when absolutely necessary. And as most of you know and have been familiar with, we can accomplish a lot via telehealth, and you can even schedule online, which is quite convenient. Another new feature is a virtual walk-in clinic to be seen on demand during our office hours, Monday through Friday, 8 to 4:30. The link is on the website. And you can also utilize this if you're interested in COVID-19 testing, both the active infection and the prior infection testing. And many questions about wellness visits and if they can still be done via a telehealth visit. Of course, there's restrictions on what we can do with a physical exam, but insurances are covering this. Blue Cross Blue Shield, Cigna, United Healthcare, Medicare. And so essentially during this virtual physical, we'll review your medications, talk about your concerns, make sure you're up to date on all of your preventative care, screening, blood results, things like that. If you have a wellness visit scheduled, but you've not done recent labs, don't cancel the appointment. Again, we can still review everything necessary for the physical. All right, so what types of in-office visits are we doing as of June? So our lab remains open. Appointments are necessary, so please call to schedule. We are continuing to do Coumadin checks. We have procedures being done by our dermatologists, such as biopsies, as well as our rheumatologists, such as joint injections and ultrasounds when deemed necessary. We have cardiac testing that is being done as well when needed. And then, of course, pre-op visits for upcoming surgeries, as those are now allowed to be scheduled in Maryland. Infusions, injections, vaccinations should all continue as needed. And then, of course, if there's an acute or a really urgent situation where we feel that we need to see you in the office, we will, of course, bring you in, and we're taking all the necessary precaution when you come into the office. So if you need to come into the office, this is what to expect when you come in. We will all be gowned, gloved, masked, eye shields, so you might not recognize us, but this is for your safety, for our safety. We'll all be in full PPE when we're in direct care with you. Our waiting room chairs have been minimized to maintain social distancing, and surfaces are being cleaned in between each patient and frequently. Please do not come earlier than your appointment time. No more than 5 minutes earlier. Come at your appointment time. If you have a lab appointment, go directly to the lab desk. Otherwise, check in at the regular counter. You may be contacted before your appointment to arrange for active infection PCR testing for COVID. So some of you may be receiving this phone call if you're coming in for something routine, such as a pre-op visit, just FYI. Just a reminder to please wear a mask when you come into the office, and unless it's absolutely necessary to bring a friend or family member, please come alone. Then the final thing is, if you're having any suspicious COVID-19 symptoms or have been possibly exposed to COVID-19, do not come in. Just call us, schedule a virtual visit. We can talk about what is going on with you, so we limit any possible exposure. Okay, so some information about what to expect in the next few months as we hopefully return to more normal operating. So we're going to gradually add more in-office visits to our schedule. We're going to continue to limit the number of providers, staff, and patients in the office at all times. As many of you know, our office is very large, so it is important to do so. And again, our staff will be in full PPE gear when we are in contact with you. If you have an upcoming scheduled appointment and you're wondering if it's going to be virtual or in person, we will be calling you about a week before to determine if it needs to be converted to virtual or will be an in-office visit. And then virtual visits will continue to be offered and might be the wave of the future. In fact, I'm sure some of you realize they can be more convenient and easy for you as the patient. And then our next phase for increasing in-office visits will be in early July, but is still TBD. So during this phase, our primary care providers may plan to do a half day of virtual visits and then a half day of in-office visits to continue to limit exposure and the number of patients in the office at any given time. And then again, to reiterate, if you feel you need to be seen in person, just call us and we can talk about it. All right, so at this point, we will open things up for questions.
Yes, we have a lot of questions. So I am going to, I'm going to ask, I think there's a few other physicians on the panel, Doctor, I think, Ketan, I see you answering some questions, so you might get an individual answer back to your question in type so that we can get as many of these answered. But all right, so and for Christina and Dr. Tanenholz, if you, a lot of these questions I think we don't know, and we're not the health department, so we'll try our best. But any idea of when Rockville Internal Medicine might start doing procedures like colonoscopies and I guess along with that, x-rays, pulmonary tests, all the other kinds of in-house testing?
So sure, I can take that. So I think the gastroenterologists are starting now to do colonoscopies and EGDs. I think in the last couple of weeks they've started back again. They are doing COVID-19 PCR testing, I think 3 to 4 days in advance. And once you have one of those procedures scheduled, the GI doctors and their staff will let you know how you need to coordinate the testing. But they are starting to do those again. So if you had a procedure with GI that was canceled for March or April, et cetera, just call the office if it hasn't been rescheduled yet. or you can send a message in the portal to your GI doctor or your primary doctor, and we can help coordinate that. So those are definitely up and running again, slowly, but those are happening. The other procedures, what were the other things, like stress tests, or what was the other question?
I've had a lot of questions about DEXA, bone density.
And radiology.
And
I think, correct me if I'm wrong, but I don't think we've decided on a date for opening X-ray yet, which includes DEXA. So, but if someone needs an X-ray, we can send you to another radiology facility. DEXAs, if you have been getting your DEXAs at our office, it is better to wait to get them so it's on the same machine. But if you do need something like obviously a chest X-ray, mammograms and things that are always done at other radiology places, those are all up and running again. And so we can help schedule those for you and refer you to the correct places. Yeah.
Okay. And then I guess we're gonna get a lot of these questions as things open up, but somebody wants to know if they should get tested if they participated in the past or plan to participate in a protest in the future.
Oh, can I just say one quick thing? So right before we started, had the television was on in my house, and the governor of New York was recommending that anyone in New York who had been to a protest in the past week or so go and get tested. And they were opening more and more testing centers for asymptomatic patients who had been at these rallies. As far as I know, I don't think that the governor of Maryland or DC or anything, mayor of DC, has said anything like that officially. So we can wait and see. I do think, unfortunately, those are probably high risk situations. And at the very least, you should look out for symptoms. I don't know if you need to definitely get tested, but if there are places now where you can get tested without symptoms. So if you want to, I think you can look into it. I don't know that we need to recommend it for every single person who went to protests yet, but New York said that, so maybe Maryland will too.
Yeah, and then just anticipating this question, a lot of my patients are asking about getting tested before seeing a family member or before a vacation coming up. What would you recommend for those people?
Yeah.
So as long as both parties have been isolating and following the necessary precautions, and no one is especially high risk, I don't feel it's necessary to test prior.
And then I don't know, I don't want to swamp poor CVS, but we have found that CVS Minute Clinic has been doing testing. It's not the nasopharyngeal testing, that's the deep testing. They do a nasal swab, but they seem to be extremely lenient on who they are testing. So I think if you are without symptoms and you are almost just curious about your status, CVS Minute Clinic is one of the places to be. I don't think you even need an order from a doctor. You can just go, and you might need to see one of their, I think they have some kind of.
You don't need an order from a doctor. And
you don't need anything.
You don't
Okay.
need a visit. You just need to complete the questionnaire online ahead of time. And you do need an appointment slot. As of a week or two ago, I think there were 3 CVS Minute Clinics in the Rockville area. There may be more that are opening up for testing, and they do a drive-through. You complete a form online in advance, and you say whether or not you have an order from your doctor. You answer some questions about symptoms, exposures, if you're high risk. And I haven't heard of too many people being turned away. I'm not 100% sure if you have 0 symptoms and low risk and no exposure. I'm not sure they'll test you without an order, but I don't know if any of the other doctors have found that. I think you have to answer something positive on the questionnaire.
All right, and then here's a pulse oximeter question. If one has symptoms, do you recommend using a pulse oximeter to track their oxygen levels? If so, at what level of oxygen should they be concerned?
Sure. Yeah, so essentially the pulse oximeter can be very useful if you are COVID positive or symptomatic. Ideally we want you above 94, 95. However, please just speak with your provider about your symptoms, because if you're reading 99 but you're feeling horrible, then we certainly need to talk. So number is not 100% predictive value regarding your current health state. So yeah, definitely just speak with your provider, but generally above 95 is what we like to see.
Question here, should pregnant women go to the hair salon?
Do our pregnant women want to answer that question?
Well, Dr. Tanenholz, I think on our slide, hair salon is considered as
High risk.
Yeah. So yeah, it's hard. I mean, the concern is the, the fumes, the close environment. Yeah, I would say if you can avoid it, that would be ideal. Or perhaps go first thing in the morning before anyone else is there, and maybe sit as close to the door as possible. I think hair color adds added risk, but if it's a cut, I think it's less risk.
The other thing a lot of people have been doing, and if you have somebody who cuts your hair that you're comfortable with and you know them very well, you could have them come to your house or do it outside at your house, because obviously there's still the risk of you and that one hairdresser, but then you take out the risk of the people checking you in and all of the other things in the hair salon. So you get your hair cut and there's only risk of contact with one person instead of everyone there. So yeah, I think that, if you really want to, that might be a good option for you. Or like Christina said, try to get the very first appointment in the morning. So things have been cleaned. Obviously, they should be cleaning between every client, but that way you'll be extra careful.
Okay, and then I can answer, somebody asked, are the slides on your website? So they will be posted. There's a little bit of a delay between all of our webinars and things getting posted, but Christina actually is the one who posts them. So what is the turnaround time usually on getting things on the website?
So typically within 3 to 5 days of the presentation.
Yeah, so that's where you can see them, and then you can use all these links and look at things a little bit closer and share with your friends. And then the video is posted also on the link to the video is posted on the website, but it's a YouTube video. And then somebody, Dr. Kaitan had answered this privately to this person, but somebody had asked, when are the pools going to open? And like I said, that's a health department question. We don't know the answer to those kinds of things. I don't know if that's outlined in one of the phases. I know my neighborhood is not open.
I'm not 100% sure, but I think once we move into phase 2, there may be opening rules about pools being able to open with limited capacity and special rules. But we're in Montgomery County, we're not in phase 2 yet, but I think there might be some options for that in the next phase.
And then I know that Christina went through a few slides on antibody testing, but we had a lot of questions on the antibody testing. So could you maybe just give your summarized spiel of what you tell patients who call and want to, they think maybe they had exposure in January and they want to get tested now for their antibodies. If you could maybe talk about which test.
Yeah, absolutely.
Yes, just a little bit more about sort of our office policy, because I know we're not very loosey-goosey in ordering that for everybody.
Right. Yeah. So again, virtual visit is required to get any type of COVID testing. And so essentially, if you get an antibody test, I just want you to know that this does not guarantee protection against COVID-19. It's not 100% sensitive or specific to with the results. And essentially, you still need to practice all the precautions, universal precautions that are being recommended in Montgomery County. And we are using the LabCorp Roche as our preferred testing because it does have a higher specificity and sensitivity. And we are sending the orders to be done at the LabCorp locations. If your insurance covers Quest only, then we can talk about the Quest antibody testing.
And then I've seen is people who have been infected once can get infected again. So even if you do get the test and you had positive antibodies, we just don't know what that really means, to be honest. But a lot of you guys are asking about the different tests. There's about 20, and like Christina said, we can specify the Roche for certain ones, and it seems like the Roche test is one of the better tests, but we can't always guarantee that the lab will run that test because these labs are not done at our lab, they are done at outside labs.
Yeah. Well, we are ordering, though, especially the Roche test, and we are able to specify that now. That wasn't true a few weeks ago. So if one of our providers orders it for you, it will be specified as Roche at this time on the order to LabCorp. If you're coming in for other blood work, like for a physical or something, and you want to have that added, you can discuss it with your provider and see if it can be done at the same time. And I know some patients have gotten antibody testing done through their places of work, and they've been sent to get them either at Quest or LabCorp without orders from us. If you have those results and you have questions about them, you can, make a virtual visit and share those results with us, and we can help you interpret them. There have been some data about repeating the test. So if you've got a positive antibody on a test where the specificity is not very high, and wasn't the Roche test, and you want to then repeat to confirm it, if you're then positive on 2 different antibody tests, then that's obviously very helpful. So if you have a positive test from an outside lab other than the Roche test, and you want to discuss it with us, we might be able to help you interpret the likelihood that it's accurate.
This patient asked you to put the risk levels back up briefly. I don't know if you know what slide.
Know about the activities?
Yeah.
Yeah. I can.
That was helpful, that green, yellow, red slide.
I can bring that. Now I know what I'm doing. I can bring it back up.
And then there's a few questions here about when things do return, how squeamish are we about that? So specifically about, if the schools do open in the fall, what are our thoughts? If gyms reopen, what are our thoughts? Flying at this time versus driving. Maybe Christina, you can talk about that.
Sure. Yeah. So sorry, someone's mowing the lawn outside, so there's a lot more. But yeah, flying versus driving. So that's a good question. One thing you could do is call the airline and see how full your flight is. If it's less than 50 or 30% capacity, then I think that would be an okay option. Most airlines are requiring you to wear your mask the entire time. Of course, if you're in a high-risk category, I probably wouldn't recommend it at all, but otherwise I think it's okay. It might be safer to do so now than in the winter months, but a lot of that is to be determined. Yeah, driving, you can certainly drive, but then you're using public restrooms, worrying about stopping at hotels. So I do think that you can fly to some degree of safety right now if your flight is not full, especially. And then regarding schools opening, what are our thoughts on that? So I don't see it being a normal reopening in the fall from both discussions with friends that work for the county, as well as seeing what is going on with our gradual reopening plan. And then safety about returning to gyms at some point. Again, I think Montgomery County is being really super cautious, which is great. And I think that when gyms do reopen, they are going to do it very, very gradually with maintaining social distance and very high standards for cleaning and disinfecting.
Yeah, and they'll probably be at much limited capacity. So if, for example, if you go to a spinning class and there's normally 30 people there, it'll probably be like 15 or less, so that people can spread out. Because the problem with being in a gym class where people are breathing heavily and things, it's sort of the same idea as being in a religious ceremony where people are singing a lot, or at another event like that, you can easily spread germs that way. So yeah, it's going to be a very gradual, and there might be, things like gym classes may not happen, and it may be more like just one-on-one activities or with a trainer, that kind of thing.
Yes. So sorry. Like Christina, I just have a dog that entered the room. So sometimes there's just home distractions here. Somebody asked, is there a wait time? Do you have a recommended wait time for a grandparent to see a newborn baby? I get this question a lot. What are you guys telling your patients?
Yeah, it's very tricky. I mean, I've had a few patients ask to get tested, even though asymptomatic, in the past few weeks, and we really didn't in our office have the capacity to do that. I think most of if it's a brand new baby, I'm pretty sure that the mothers are being tested when they go to deliver or close to the time of delivery. The baby should be fine, and if the mother doesn't have it. If there's a high risk grandparent, it's tricky. I mean, they probably want to avoid interactions with too many other people. They could come and see the child from a distance. But if they have no symptoms and have not been exposed and have been quarantining for the last 14 days pretty much and avoiding going out, then I think they probably are safe, to see the one child and family members. If the adult, grandparent or whatever had been traveling right beforehand or something, that might be a little more concerning. Because then they could have asymptomatic spread to the child or the other family members. But if they've been, so my recommendation basically is if there's a baby about to be born in your family and you're a grandparent or an aunt or an uncle or something, be extra good with your social distancing for a few weeks ahead of time and avoid traveling before you see the child. If you have to travel to see the child, then try to get there before the baby's born so you can sort of quarantine for a little while first. And I think some people have done that.
Yeah, I just want to let people know, because we're probably going to wrap up in the next couple minutes. We had about 45 questions submitted. So if you didn't get to yours, it's absolutely not personal. It's just that, I'm trying to pick out the ones that I think are relevant to the most number of people. So here's a question. As we are getting a little more comfortable about going out and interacting with people, if somebody is doing, say like a backyard barbecue, a social distance sort of barbecue with another, 2 or 3 people in the yard, what kind of precautions would you recommend in terms of distance and mask wearing?
I would recommend that when you're not actually eating or drinking, try to keep your mask on. Obviously, when you're eating, you can't really keep a mask on. In an ideal setting, if it's something in your backyard and people can bring their own lawn chairs, that might be a good idea. Or just clean off the chairs between different people sitting on them and try to keep some distance. But beyond that, I think it's fairly safe, especially if it's just with a small group and everyone's not, sort of sitting on top of each other. So spread out, wear a mask when you're not eating or drinking, and otherwise it should be a fairly, on here it says low to medium risk event. I think that's probably pretty accurate.
Yeah, and then similar thread, as people return to maybe some vacations this summer, do you have any recommended precautions for hotel stays or rental house stays?
Do you want to?
Sure. Yeah. So when you get there, I would recommend cleaning off the commonly touched surfaces, door handles, light switch, countertops, TV remotes, basically just a quick disinfectant of all high touch areas. If you can bring your own linens, that would be probably ideal. If you're staying in a hotel, take off the comforter on the bed, just use the sheets, things like that.
Okay. So I just want to say, because we probably have about time for 1 or 2 more questions, but for those of you who are asking a lot about more antibody questions, I would recommend that you do schedule a virtual visit with one of us, just because there's a lot of questions that go into that. What symptoms did you have? What are your other health concerns? And then there's a little bit more counseling that often happens. What does this test mean, and what do we do with results? So again, we are open. We are doing our virtual visits. All of us are seeing people, and there's a lot of availability. So don't feel like you're bothering us, because we've heard that a lot from patients. We definitely are happy to see you and accommodate you through that virtual visit. And it's not all the Privia platform. We do these also through different apps and FaceTime. So there's options if you're not very technologically savvy. Don't feel like you can't possibly navigate a virtual visit. All right, let me pick out Maybe there's an uplifting question here. Let me see if there's anything here that is happy, but probably not.
Just to cheer you up, remember, we are in phase 1. We weren't in phase 1 at our last talk. So we are making progress, and there are seemingly less new cases. So
Yeah.
we are flattening the curve, it seems.
Yeah. And there are more tests. All right. It looks like actually Christina and Dr. Kaitan were very efficient in their answer of questions along the way. Somebody had asked, here's maybe a last sort of more philosophical question, but why is it that Montgomery County seems to have more cases than other places?
Well, I don't think we know
For
exactly.
sure, but what are your thoughts?
Yeah, one thing is, we're closer to DC, and DC, Montgomery County, Northern Virginia, there's a lot of people going in and out of all the different counties. There's a lot of people who travel, especially at the beginning of all of this. Also, and I just am pretty sure of this, but I'm not positive, Montgomery County is pretty densely populated. So it's harder for people to really social distance maybe as much as in some of the more rural areas of Maryland, where there just aren't as many people. So I think those are probably a lot of the reasons. And, PG probably for some of the same reasons. And a lot of people are working in all of these areas with jobs where they couldn't work from home. So that continues to maybe add to spread a little bit. Any other thoughts, Christina?
No, I agree. Yeah, I wish we had an answer to that. But unfortunately we don't.
I think we also have a lot of, one of my theories is that we probably have a disproportionate number of assisted and nursing home facilities. One, because we are more populated, but also because, those are a business and they tend to be high-end, rents. And so I think that they have strategically chosen probably to be in a wealthier county like Montgomery County. And if you look at a lot of the rates of COVID spread, a lot of them are in these nursing homes and assisted living. So I think we also have a little bit of a heavier burden with that population too. So I think that might also contribute, but definitely, like we said, we don't know these. These are epidemiology questions. We can only speculate.
Yeah, and also if you're interested, think it's on the Maryland Department of Health website. There is a tracker that looks at assisted livings and nursing homes and tells you on a sort of daily basis how many cases are at those facilities. So they really are tracking that individually, and it has been pretty high in some of these places.
Yeah. All right. Well, I want to thank Christina and Dr. Tanenholz for being with us today. Not only are they doing these webinars, which are very helpful, but they are part of our COVID task force, and they are really helping to keep our office up to date, getting those kinds of tests in-house, deciding what to do. They're working with our lab manager. So there's a lot of work that happens behind the scenes. It's not just these webinars. We're really trying to be up to date on our evidence-based medicine and provide you guys with the safest and best care. So thank you to them for talking today. Thank you to them for being on that team. I really appreciate it. And then just a little quick announcement before we adjourn for the afternoon. There will be no webinar on Wednesday, but on Friday there will be a webinar on health disparities and race. Dr. Christina Council, who has a master's in public health, and I are going to team up and lead a little discussion about higher rates of cardiovascular disease, diabetes, asthma, and that kind of stuff, and talk a little bit about why that happens. We're trying to stay current with the news, but also stay objective and fact giving. So that should be an interesting discussion Friday. And otherwise, have a good afternoon to everyone. All right. Thank you. Take care, guys. Have a good day.
Thanks everyone for joining us.
Thank you. Bye.
Bye-bye.